Yeah, just a quick review of the book, Exercise, a Non-Pharmacological Strategy for Managing High Blood Pressure. So non-pharmacological, that would be like without drugs. Sounds good. The less medications you take, the better. Basically, the book's divided up into 3 chapters. I'll just name each 3 real briefly, just to give you an idea what's in the book. First one talks about the types of exercise. It talks about the major ones are like aerobic exercise, resistance exercise, that'd be like lifting weights, balance exercises, and flexibility exercise. Second one talks about measuring your blood pressure. And then the third one is how exercise lowers your blood pressure. And this chapter also goes into like exercise safety and indications of, when to stop exercising. You might be doing too much of a good thing. So covers that kind of stuff. So yeah, all in all, I think if you're looking to like, you have your blood pressure is high and you want to, do exercise to try and get it down, you're not really crazy about taking the drugs, because they have certain side effects too. I think it's a pretty good resource. The book does mention resistance exercise. If you do start lifting weights and you find you have like shoulder problems, which is real common, I just want to bring up this book, The 6-Minute Torn Rotator Cuff Solution, for seniors. Actually, anybody can use, not really just for seniors. But actually strengthening your rotator cuff will solve a lot of different shoulder problems, even like chronic shoulder pain. Rotator cuff is really the main stabilizer of your shoulder's shallow ball and socket joint. So if you increase the stability of your shoulder joint, a lot of other shoulder issues are just plain going to go away. So definitely worth it. Real briefly, this kind of goes into like what the rotator cuff is. Has a lot of pictures in it, so if you're a real visual learner, this is a good book for you. Part 2, answers you need to know. If you do have a tear in your rotator cuff, has lots of things you're going to want to know about. What are the symptoms of a rotator cuff tear? Are any arm maneuvers that indicate I have a torn rotator cuff? Where does it tear at? Are there different kinds of rotator cuff tears? See, lots of pictures. I have a torn rotator cuff tear and I'm in a lot of pain. I need surgery, right? Well, not necessarily, because the size of your tear doesn't really indicate how much, necessarily how bad you're going to hurt. For instance, each one of these blocks here is like a study. You can find people with large tears that have no pain, and you can find people with small tears that are in excruciating pain. So not necessarily, pain doesn't necessarily correlate with the tear size. What happens if I just leave my rotator cuff tear alone? Well, the only way you're going to know that is if, you do some research and you take a group of people that have rotator cuff tears and you follow them for a period of time. And what happens to them over time? What does that tear do? Does it get bigger? Does it get smaller? Does it repair itself? So this book has actually looked at all the studies available. Each one of these blocks is a study, and it'll answer that question for you. What'll happen to certain tears over time? Does have a torn rotator cuff set me up for getting shoulder arthritis? So how does exercise really compare to having surgery when it comes to rotator cuff tears? Well, like the book says, the only way you're going to know is looking at the randomized controlled trials. These are the highest form of proof in medicine that a treatment actually is effective. Those would be studies where you say you take 100 people with rotator cuff tears, and 50 you're randomized to surgery, and other 50 you're randomized to exercise program. So what happens? So this book has actually looked at all of them and synthesized the results. It's funny, the conclusion is quite consistent in all these studies. Whether you have surgery or whether you have a good exercise program, you're going to end up at the same place over time. So there you go. To that end, the book does end with an exercise program. There's 3 different levels, a beginning, intermediate, and advanced. So like if you can hardly move your shoulder, start with the beginning one. Some people just have a little tear. It's kind of a chronic nagging thing. You can start with the advanced one if you can do more. But yeah, the exercise program really does take you 6 minutes. So this isn't any lengthy thing you're going to have to do, every day, 30 minutes of exercise. So yeah, if you start lifting weights to control your blood pressure, you run into shoulder issues, I'll bring that one up. This is a good resource. But yeah, just looking for exercise in general, I think definitely most cases good to try exercise first before starting a lot of medication. So yeah, good resource for that. Check it out.